when you stay home. On behalf of those frontline workers, I want to first of all thank everyone who's been doing their part to stay home and help keep us all safe. I also visited this weekend. I went for a walk over at the Precinct 4 Park in the Jesse Jones Park by IAH, and I saw people enjoying the outdoors, enjoying their families while keeping their distance from everybody else. There were folks fishing, but several feet apart from one another, certainly more than 6. Folks in very small, 2, 3 people. Clearly it was their close family. Nobody on picnic tables or benches or any kinds of surfaces. And so I want to say thank you to every single person who is making the most of this situation, who is taking their own personal responsibility for their safety and the safety of each member of this community. We're noticing, we see how folks are taking the necessary precautions. We see that there aren't many people out and about, and that those who are out there keeping their distance, and that's what we need. Is if we're going to be able to continue enjoying our parks, we've got to ensure that we're not using exercise equipment, playgrounds, that we're not playing any sports. If you're tossing around a Frisbee, that's something that you're touching and you're passing around to somebody, and then you're touching your face. So no kinds of sports of that sense. But folks who are walking, who are jogging, riding their bikes, who are in 2 people, 3 people, that's exactly what we want to see, and I'm just so grateful for it. Those are real people who are making this battle against the virus a possibility of success, and to the extent that we continue doing that, our chances of success to increase. Now, yesterday, the CDC extended their guidance for an additional 30 days until April 30th. And we're all aware that the order that I issued last week expires later this week on April 3rd. We're continuing to look at numbers. As folks have seen, we've had spikes. We've had a lot of growth in the case count within Harris County, including the city of Houston. And so I'll be making a determination tomorrow. I've been in contact with the different stakeholders, with Mayor Turner and other mayors. And the reality of it is, the question is not whether we'll be extending the order. It's really a question of for how long we'll be extending the order for. And this is really difficult. It's a difficult position we're all a part of, and it's a burden that we have to bear for the sake of our health and for the sake of saving lives. What we can do is provide some sort of certainty within the uncertain situation that is that virus. And so that's what I want to work toward, is try and provide some certainty as to how long the order will stay in effect for. Right now we're seeing too sharp an increase still to even consider stopping it. And then I also want folks to know that once we move forward enough and we get to the point, certainly not at the end of this week, but in the future, where we feel that the order can be relaxed, it's not something that we'll be able to just lift. And so all of a sudden you go from the order being in effect until, and you go to complete back to normal, because the virus is going to pop up again, when we relax the order. And so the way we should all already be thinking about it is, if and when we get to that point, or when we get to that point, it'll be we'll relax parts of it, and then we may have to put it back on, and just watching how our trends do and how the projections do. This is, as we've discussed, it is something none of us have ever lived through before. It's uncertain, it's incredibly difficult, but it's something that we all have to bear. It's a necessary burden, and we're doing it for the sake of our health. That said, of course, we've worked to try and ease the impact on people to the extent that we've been able to. The federal government, we're glad for the package of support that they've all worked on. Locally, as you know, the judges, our justices of the peace, will not be hearing eviction dockets until at least mid-April. And so if you are not able to pay your rent because of coronavirus, those cases will not be moving through the courts. Of course, if it's a domestic violence, some sort of more serious reason why somebody will be evicted, that does have to go through the courts. Rent will still be due at some point, but certainly through mid-April, and if we have to extend the eviction past that, the date at which evictions will be looked at once more, I'm ready to do that through an order. And so as long as we have this situation going on, we'll be working to try and ease that eviction issue from people's mind who aren't able to pay because of coronavirus. And so, rent will still be due, but down the line, something else I want to highlight is a step that our tax assessor, Ann Harris-Bennett, has taken, and that is to give a 3-month extension of all delinquent property taxes. So the taxes now will not be due until June, and the penalty and interest will still be due at that point. As with the evictions, the taxes will be due at some point, but for now, folks have a 3-month respite. And, as you know, the toll roads right now we're not charging for. We've got our county employees who can volunteer as well under their work for the county to support food banks and other necessities. And we're continuing to explore what more we can do at the local level to ease the burden on people. We'll continue looking at that. Something else I wanted to announce today is a dashboard. As you know, Ready Harris is a Swiss Army knife of sorts for where people can find information about the virus, how they can access testing, how they can report violations of our order, how they can report price gouging. And now we also have this dashboard available with the latest information on the cases. The dashboard will be updated daily, and so this is a Harris County Public Health dashboard. You can see the current active cases that are in Harris County outside the city of Houston. If you go to the top center, you can even see by quadrant of Harris County which quadrant has a certain number of cases. There is one space there where it says total cases 563. That is the total count as of right now in all of Harris County, including the city of Houston. And so that is the number that will have the combined number of cases for all of Harris County, including unincorporated areas, our different cities, and the city of Houston. And we hope this will be a useful tool for folks. As I said, it'll be updated daily. One thing I want to highlight is the goal behind the dashboard is transparency. It is being able to have as much information as we can get our hands on. But we have to keep in mind that it's not the end-all be-all. We know that there's limited testing in our region, and so in many ways it's incomplete. For every case that we have diagnosed, there are many others we haven't diagnosed because of the limited testing that we have. We've always had an issue with not enough test kits, and we have more now, but we're not other nations, for example, that have been able to do less restrictive social distancing. They've been able to do that because they did a lot more testing, a lot more social tracing, and we just don't have those capabilities. And of course, while we continue to test people at full capacity every day throughout our sites, the test is not a treatment. A test is not a cure. And I want to make sure everyone is clear. If you are feeling sick and you have symptoms consistent with coronavirus, assume that you haven't. Don't go to work if you are part of an essential business. Stay away from loved ones if you're home. Even if you can't, or if it takes time for the test results to come back, if you haven't accessed a test, we have limited capacity. We're prioritizing those folks who are at highest need, who are at most risk of the disease. But we can't test everyone given supplies, and so it's really more a source of information, but it's not the end-all be-all. And if you feel sick, you should avoid other people and certainly avoid work if you're part of an essential operation. I want to conclude with a note on the governor's executive order about the jail. And, he made very clear that jail should not be releasing folks with violent histories. I agree with that completely, and certainly was not something that was ever under consideration. We continue to address the issue that is our county jail, where we have at this point close to 8,000 people who are all in close contact, and if we have an outbreak at the jail, we already know we have a case. That would mean many thousands of people who are sick, thousands of people needing respirators, needing medical attention, and so it would be a crisis not just for the jail or for the 3,000 workers that are part of the jail, but also for the rest of the community, which has access to limited healthcare capabilities. And so we're continuing to sort out what options we have. I've been in touch with our judges, and I hope to be able to take some definitive steps tomorrow. We've been working on this just day and night for quite a few days at this point. So let me stop there. I'll repeat my remarks in Spanish, and then Dr. Shaw, our public health director, is here to help answer questions alongside me. En español, quería contarles primero que este fin de semana visité un centro de llamadas, un banco de llamadas, donde están trabajando enfermeras, están trabajando estudiantes de medicina, voluntarios, también entrenados en contestar preguntas de la comunidad, referir a las personas que están buscando ser parte de una prueba, que están buscando una prueba del coronavirus y referirlos a las sedes de pruebas. Son enfermeras, son voluntarios increíblemente dedicados. Ninguno siquiera levantó la cabeza para saludar. Todos estaban recibiendo una llamada, colgaban, recibían otra llamada. En este momento, desde el lunes pasado que empezamos a hacer las pruebas, ya hemos llevado a cabo más de 3,700 pruebas en las dos sedes del condado. La sede de la ciudad sé que ha estado haciendo más de 200 o alrededor de 250 pruebas al día, también como hemos hecho nosotros en nuestras sedes. Y estas enfermeras, estas personas, son las personas que estamos pidiéndole a usted que nos ayude a proteger, tanto ellos como los policías, como los trabajadores de salud pública, los médicos. Esas son las personas que protegemos al estar en casa. Y quería, pues antes de anunciar las noticias, la información que tenemos el día de hoy por parte del condado, darle las gracias a todos los residentes que nos han ayudado al quedarse en casa. Visité también este fin de semana, salí a caminar en el parque de Jesse Jones, cerca del aeropuerto Bush, y vi personas disfrutando el aire libre, pero de una manera increíblemente responsable. No vi ni un solo grupo, eran simplemente 2 o 3 personas. Las personas pescando mantenían distancia mínimo de 6 pies, nadie usando mesas, ni bancas, ni ningún tipo de superficie que sabemos puede contagiarnos y esparcir el virus. Entonces realmente fue muy lindo para mí ver eso, y le doy las gracias a todas las personas, a todos ustedes que están quedándose en casa, que si salen simplemente están saliendo para trabajo esencial o para actividades esenciales como lo es ir al supermercado o ir a respirar un poco de aire fresco. Como ya hemos mencionado, no debemos estar jugando fútbol, frisbee, nada que estemos jugando en grupo, tocando ninguna cosa en grupo, sino salir a caminar 1 o 2 personas, montar bicicletas, y es a pescar igual 2 personas, pocas personas. Entonces, quiero darles las gracias. Sabemos que la orden bajo la cual está el condado expira ya el 3 de abril, es muy pronto, y he recibido muchas preguntas acerca de si la orden se va a extender o no. Realmente, lo que estamos intentando decidir ahorita, y tendremos una decisión el día de mañana, no es tanto si se extiende la orden o no, sino por cuánto tiempo se va a extender. sí se va a extender la orden. ¿Por qué? Porque hemos visto, ya seguimos viendo un incremento en número de casos. El día de hoy, 563 casos en total entre el condado Harris y la ciudad de Houston. Entonces, dentro del condado Harris, 563, ese es un crecimiento también exponencial en el número de casos. No estamos en este momento a tiempo de responsablemente decir que vamos a levantar la orden. ¿Qué significa eso? Es difícil para todos, es difícil para la economía, es difícil para las personas que no tienen trabajo en este momento, es una situación realmente muy dolorosa para muchas personas. Pero lo estamos haciendo por la salud. Es un reto que tenemos que abordar, que tenemos que asumir para proteger a la salud de todos, la salud nuestra y la salud de todos los otros residentes de este condado. Entonces, esa es la decisión. También quiero explicar que en el momento, bien sea en un mes, en el tiempo que sea, cuando ya se levante la orden, no va a ser de día y noche que de repente regresamos a la normalidad. Va a ser un proceso, porque el virus todavía existe. Entonces, si levantamos la orden al 100%, el virus regresa y nos encontramos en una situación peligrosa nuevamente. Entonces, cuando lleguemos a la conversación de levantar la orden, y será en un futuro, en ese momento ciertas medidas. Después, a medida que vuelva a subir el virus, tenemos que volver a implementar las medidas, y así será, así lo han hecho en otros países. No podemos simplemente prender todo y luego apagar todo y luego volver a empezar, porque el virus se nos va a encimar nuevamente. Ese es el camino en el cual vamos, y quería simplemente explicarles a todos lo que estamos diseñando con los expertos de salud. Como sabemos que este es un reto para todos muy difícil, especialmente por el punto de vista económico, hemos tomado ciertas medidas para intentar mitigar los efectos. Por un lado, el gobierno federal ya anunció su paquete de ayudas, eso lo agradecemos muchísimo. Por parte del condado, como saben, no habrán desalojos hasta al menos mediados de abril. Si necesitamos extender la orden más allá, yo extenderé eso. Por ahora son los jueces los que no están aceptando ningún caso de desalojo. Entonces, no va a haber una corte que vaya a ordenar un desalojo, a menos de que sea un caso de violencia doméstica, un caso de violencia. Fuera de eso, si es alguien que no puede pagar por caso del coronavirus, no se harán desalojos. Eso sí, tendrá que pagar renta cuando vuelvan los desalojos, en unas semanas, en un mes, lo que sea. Entonces sí va a tener que pagar esa renta, pero por ahora no, si no puede pagar por el coronavirus, no se preocupe, ya que no habrán desalojos. También quiero anunciar a Ann Bennett, quien es la asesora de impuestos del condado, le ha dado 3 meses de extensión a todas las personas con impuestos de propiedad atrasados. Entonces, si no pudo pagar sus impuestos de propiedad, no los va a tener que pagar sino hasta junio. Igual que con los desalojos, los va a tener que pagar en algún momento. Con esto sí habrá multa, habrán intereses, pero por ahora no hay que pagarlo sino hasta junio. Seguimos trabajando en otras cosas que podamos hacer. Por ejemplo, los empleados del condado los estamos pagando para que ayuden en sitios de voluntariado donde puedan ayudar a repartir comida, cosas que ayuden a la comunidad, y seguimos explorando los peajes, por ejemplo, nos los estamos cobrando en las carreteras, y seguiremos explorando qué más podemos hacer por parte del gobierno local para intentar suavizar un poco el impacto tan fuerte que está teniendo esto en las personas, todos quienes viven en el condado. Algo más que quiero anunciar es el tablero digital que tenemos ahora en Ready Harris. Como saben, readyharris.org se ha vuelto la fuente de información donde puede reportar violaciones a la orden, puede reportar abuso de precios, puede leer la orden, y ahora también podrá ver cuántos casos hay en el condado día a día. Entonces estaremos actualizando los casos diariamente, y se ve ahí los casos activos por parte del condado Harris, fuera de la ciudad de Houston, cuántas personas se han recuperado, hay 2 muertes, las edades, inclusive hay manera de hacerle clic ahí al centro y ver los cuadrantes del condado, en cuál cuadrante hay cuántas personas. Hay un número que quiero explicar específicamente, es el número 563, y ahí ese es el número de casos que hay en el condado Harris en total, incluyendo el condado y la ciudad. Entonces, ahí estaremos actualizando con los números también de la ciudad y se trata de transparencia, de tener toda la información al público. Pero pues es importante recordar que tenemos muchas limitaciones en cuanto a las pruebas. Hay bastantes pruebas que nos gustaría poder hacer, pero simplemente no tenemos más materiales. Entonces, por cada caso que ven ustedes, imagínense que hay muchos más, porque no somos como otros países que han podido tomar medidas menos drásticas en cuanto al distanciamiento social, porque tienen acceso a muchísimas más pruebas, a muchísimo más análisis, acceso que nosotros no tenemos. Entonces, esto es simplemente información y también es importante recordar que una prueba no es una cura. He escuchado de personas que me han dicho, mire, yo me hice la prueba, pero no he recibido los resultados aún, ¿qué hago? Y la respuesta es, si se siente enfermo, si siente síntomas de gripe, síntomas consistentes con el coronavirus, asuma que tiene coronavirus. Quédese en casa si trabaja en un trabajo esencial. Si no es parte de trabajo esencial, quédese lejos de sus familiares y de otras personas. Porque igual la prueba lo único que va a hacer es decirle que tiene el virus, no es tratamiento. No tenemos ahorita tratamiento. Entonces, es algo más informativo. Y por eso lo estamos compartiendo, por eso seguimos haciendo pruebas, pero hay que saber que ahorita es el distanciamiento social. Si está enfermo, por favor, asuma que tiene el virus. Y si no está enfermo, igual lo puede tener y puede simplemente no tener síntomas, entonces, y puede ser contagiado, y por eso tenemos que seguir trabajando por quedarnos en casa, y si salimos al supermercado, al parque, mantener esa distancia. Simplemente la última nota que quería decir es acerca de la cárcel. Sigue siendo ese un gran reto. En este momento casi 8,000 personas en la cárcel. Ya tenemos un caso en la cárcel que recibimos el día de ayer. Y el problema con la cárcel es que no se trata simplemente de las personas que están ahí, ni tampoco de los 3,000 trabajadores, sino de toda la comunidad. Porque si 8,000 personas se enferman, son muchas personas, al menos cientos de personas que van a necesitar cuidado urgente en el hospital. Y esas son camas y son materiales que entonces no van a estar disponibles para el resto de nosotros. Entonces, por eso estamos trabajando por reducir la población en la cárcel. El gobernador promulgó una orden diciendo que no deben haber reducciones, no se debe dejar libre ningún criminal violento. Y estoy completamente de acuerdo con la orden del gobernador. No estamos considerando personas violentas, pero sí estamos viendo qué podemos hacer con aquellas personas acusadas de crímenes no violentos y que sí están causando una situación muy peligrosa y muy delicada en la cárcel en este momento. Entonces, con eso dejo mis comentarios. Ahora vamos a recibir preguntas y también está el doctor Shah para responder cualquier pregunta que tengamos. Yes, go ahead.
Okay, great, Judge. Thank you. My colleague Ted Oberg would like to know how the governor's order impacted what you have been working on for the last couple of days. You said you're trying to make a decision, trying to sign something maybe by tomorrow. Do you have a set number of like the 8,000 inmates, about what percentage do you believe you can release or can legally make that occur?
So the governor issued an order saying that no violent or folks accused of violent crimes should be released, and I'm 100% aligned with him on that. We've never considered releasing folks accused of violent crimes. What we do know from the healthcare experts is it is certainly a ticking time bomb. We already have a case in the jail, and we've got to work to decrease as much as possible the number of people in the jail. We've already had in process the possibility of transferring some inmates to the old Little Baker facility, to other facilities we've identified. The issue is it takes some time, you know, at minimum a week, perhaps closer to 2, to prepare some of those facilities, and with that we would only be able to transfer a certain number of inmates. And so in the meantime, you still have a case in the jail, you have several deputies who've come back positive, and you have a situation where if you have an outbreak, that number will quickly grow, and those folks will quickly be needing the healthcare resources that the rest of us need in the free world as well. And so we're moving forward with the transfer options. We are working with the state on the folks they have who are in jail for technical violations, and then we're looking at an order to release non-violent folks. And so it is people who obviously they would be released through a process, making sure that they don't have any antecedents of violent crime or allegations of violent crime. There would be conditions to the extent possible, so, you know, to where we can do ankle monitors, folks say with a DWI charge where they have to have a breathalyzer in their car, that kind of thing. We are definitely not looking to release folks who are accused of burglary of a residence or anybody with DWI third, so anybody who has a history of consistent DWI violations. But it's certainly something that has more than come to a head. We've been seeing this ticking time bomb for the last 2 weeks. We knew we would have a case if there wasn't one already. We learned yesterday there is a case. As we always have discussed with every case, even outside of the jail in our community, for each case we know there are many more, because it's not like we're testing every single person at the jail. We don't even have enough tests for that. So we can assume there are cases at the jail. There's certainly one, and it's a very contained environment. So what we're doing is how can we responsibly reduce that population as much as possible so that when there is an outbreak, there is enough space to quarantine the relevant people, to separate folks as much as possible, and to not have, you know, what would be the equivalent of what cities are seeing right now. I mean, you have cities that aren't seeing 8,000 people infected, and so that's what we're working on.
From KHOU, the DPS troops, as you know, say now they'll start patrolling around the Texas-Louisiana border. However, they're not actually doing, I guess, checkpoints. So the question is, how does the county feel about DPS's plan of enforcing despite checkpoints not being established, and do you think any of the DPS quarantine and checkpoints requirements will affect local law enforcement?
I know DPS announced checkpoints for the Texas-Louisiana border. You know, the travel already has been down. We've been looking at travel into our airports. It's sharply down. I would say in the list of priorities of how we're trying to minimize the spread of the virus, that is not near the top because we don't think it's a big source of it. The biggest thing we can do just in general is that distancing, is staying home, staying away from other people. And that will be asked of anybody who makes it to Harris County anyway. And so, you know, we're continuing to ask the questions. Is there something more we could be doing to prevent folks from coming into our county who have the virus? From the start, we've known we're not an island nation. We can't seal our borders. But where we get the most impact is in staying away from one another, and that's the thinking with the order we've implemented.
As far as overflow hospital or medical facilities, Dallas has already said they would use the KBH Convention Center if needed. As you know, the mayor here, Sylvester Turner, toured some folks, toured a facility at a hospital in over the weekend. Is the county expecting, have you guys considered or pre-identified any medical facilities or convention spaces, Astrodome, NRG, those types of places that you might have to use?
Yes, yes. We hope we never have to get to an overflow hospital space situation. We're working with the hospitals to identify exactly how many beds their overflow capacity adds up to, because whatever the county does is not to replace the hospitals extra space is to supplement the hospital's extra space. And so what we're doing above and beyond what the hospitals can do, we're looking at NRG. And so we're looking at NRG Stadium, and what we're trying to design is a multi-function facility where there would be space for quarantine for folks who don't have another place to quarantine. There would be space for some sort of treatment for people who don't need an ICU bed, but they do need to be under observation by a nurse. And then finally, and ideally, we would be able to build additional hospital capacity, additional ICU capacity. There, we're back where we were with the testing, right? What we can do at the county and what we've been doing is build all of the logistics, all of the moving pieces, the staff, everything we have to do for this to be operationally ready. But we, like every other city and county in this country, is facing shortages. We see the shortages in New York. Certainly it becomes clear when you begin having so many cases. And so we are hoping that the federal government will send us the materials for that hospital. That's what we've built out the space. We're building it out, and all we need is their materials. And so we are, of course, trying to procure our own materials, and the question is, will we be able to? I know that...
Are you talking about NRG Center? You said stadium. Which building, NRG? Are you talking about the commit? I just want to make sure it's not the football stadium. You're talking about the center?
No, it's the center. And we are still, NRG Center, not the football stadium. We're still figuring out the design for what this would look like. Yes.
Are there any information?
Let me add in, Dr. Shaw has some additional information.
And then, Dr. Shaw, since you're up here, I know several of the news outlets wanted you to go down if you have any data about how many tests the county has done, and things like that.
Sure. Thank you. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and Local Health Authority for Harris County. Thank you for those questions. And I just wanted to add a little bit more detail to what the judge mentioned. So we're looking at the NRG complex, and we haven't decided, as she said, we haven't decided where exactly things are going to be going. We're still in process. It's still a plan. Obviously, there are a lot of moving pieces as part of this. The stadium is not in the mix. However, as you know, there's an arena, there's a center, there's obviously a lot of parking. There's a lot that really goes into play there. So we're looking at all that with all of our partners, and I think the judge is absolutely correct in saying that this is a plan B, and in many ways this is really a plan C. So we want hospitals to be able to obviously be able to surge and be able to do what they can safely in their hospitals. We also want our hospitals to be able to then, with their surge planning, be able to do what they might in their own setting, which might include a parking garage or might include some other surge from their, not their traditional way, but their non-traditional way of doing things. And then this would be essentially a plan C, and there may be one of many plans that we're looking at. So Judge is absolutely correct. We're looking at all those strategies, and what we want to do is just to emphasize the fact that we recognize that while case numbers are going up and we've had really concerns in our healthcare community about what's happening within the healthcare system, we're also watching what's happening in other communities across the country. And we want to do everything we can to certainly plan ahead. As far as the tests go, I know the judge mentioned this earlier, so I want to just repeat that through our 2 county sites, we have to date, and not including today, we've tested 3,700 individuals. So those 3,700 individuals are really what we have tested between the 2 sites since last weekend into this weekend that we've been able to
what percentage of results have you gotten back, and are we still
so I can't tell you,
10, 15,
yeah, I
10,
can't tell you
exactly
the percentage of test results, because as you know, this is a federal testing center, drive-through testing center, and we are dependent, as the judge has mentioned multiple times, on resupply of PPE and personal protective equipment and other test samples, et cetera. But we're also dependent on our federal partners for the test results. And so while we have test results that have come back to individuals that have gone through both of the sites, I can't give you an exact percentage of how many we've received.
The Houston Press wanted to know, continue on the testing thing, what do you know about, like, there's been some reporting that there's a certain percentage of false negatives on these, and then they have to come back and test. and they test positive, and then people can't get, even when they, after they recover, that other test also takes more time. What can you share with us on that?
Yeah, I think it's important for us to remember is that while testing has taken a long time in our nation to really get to state and local communities, at the end of the day, we recognize that as we have also put forth these drive-through testing models and actually now successfully for a week to be able to continue to get priority populations to be able to get tested, those with symptoms, we also know there's a lot changing. And we're hearing additional information from FDA, we're getting information from our federal and state partners, we're seeing what's happening in the private sector. There's all sorts of different kinds of tests that we're now learning about, everything from at-home testing to testing that includes antibody testing and point-of-care testing, 5-minute turnaround, 15-minute turnaround, and it actually honestly can be confusing. And so what I've asked our team to do over the last couple of days is really to get a good landscape of the different kinds of test modalities that are out there and then integrate that into our strategy so we can understand better what's the best way for us to integrate new testing strategies, but also to really confirm what we're doing currently and where we need to potentially modify and or supplement, as the judge has mentioned. We want to do that. So that's what we're in the process of doing right now.
And I see that you guys sort of has an integrated dashboard, but are the county and city integrated yet? Like, can you use the county, like your website self thing? Can that go to the city site, or if you test for the city, you still have to call their phone number? I know there was some effort to integrate it. Has that occurred yet?
Right. No, so great question. I'm glad you asked that question. So we're in active discussions. The judge has made it clear that she wants to have some real one-stop shop, if you will, where you can go and you can get information about where sorts of information through readyharris.org, but also for the testing integration. And so we're in active discussions with our partners, Dr. Purse at the City of Houston. What does that look like? How do we get that done? And so right now, if you go to our web-based tool, it does not allow you to do that, but we're hoping that that changes soon so we're able to at least have integration of the one city site, and eventually if there are additional sites that are in the county or city that we can also integrate those. That has not happened to date, but we're hopeful that it's going to happen.
And if I can add on a couple of notes. So first, in terms of the testing and the results that are coming back, when we started out and we were hoping we could catch up to a nation like South Korea and use testing really as a tool to track exactly, how the virus is spreading and do the contact tracing based on that and stop it in its tracks based on that, we haven't had, and I don't think will have, at this point, the disease is so widespread, the ability to do that through testing. And so that's why, we do get false negatives. We've had to test people twice. And so, again, if you are tested and you receive a negative and you're still sick, that doesn't mean you still wouldn't want to give the flu or whatever it is you have to your family members. But regardless, this is about information. It's information for the community. It's information for us to be able to make decisions. But the most powerful tool in our toolbox is not the testing. It's just not at the level that it needs to be for the size of our population. The most powerful tool we have is the ability to stay far away from one another. And, it's that physical distance, and we've said social distancing, and then we've had folks online say, well, you could be socially close but physically distant, however you want to frame it. But the idea is not exposing ourselves to other people. And then in terms of directing folks to test sites, if you go to Ready Harris, you can see the phone number for the city site. We want to be able to screen through our tool, and we're working on that. And the idea with our online tool is because we have such a limited number of tests, we don't want to dole those out in terms of who shows up first and who waits in line the longest, but who needs it most. And so that's why we have an online screening and then a phone screening where trained professionals are able to make those decisions and refer those who most urgently are at risk of the virus to have the test. But frankly, somebody at higher risk needs hospital care, they should be at the hospital. Whether or not they have a positive test is irrelevant, really, in many ways.
So your item, just one last thing, so you have enough testing equipment or tests to go through?
At least a couple more days. We're waiting for the next shipment, Dr. Shaw. Maybe you know when it's coming back, the next one.
Yeah, Judge, you hit it right on the head. That's exactly right. So we have a couple more days. We're expecting resupply. Again, we've made it very clear that these testing sites, working with our FEMA and Health and Human Services partners at the federal level, they are dependent on the resupply. We're hopeful that we'll get a resupply today into tomorrow. Today is almost gone, so it'll likely be tomorrow, and we're hopeful for that. And I do want to just pick up on the thread that the judge just mentioned, which is absolutely social distancing. What people can do to help us really help them, help protect our community, is very much not about a test, not about just getting a positive or negative result. It's really what can we do to really make sure that we do not somehow expose others, especially if we have symptoms. To date, we've actually had about 80,000 hits to our online tool, which is great. And a good portion of those individuals who have gone to that online tool have been really screened out, reassured, if you will, that they do not need to be tested. Hopefully we get to the point where testing, in terms of the number of tests and the constraints on tests in our community and across this nation, is not still an issue. But today it still is.
Thank you. I think we're done. There no plans to stand up another site, right?
No, we were given, the federal government said you get 2 city sites, 2 county sites, and then, that's where we were. All right, thank you so much. Thank you.